The next vitamin is vitamin B2 Riboflavin, which can also be remembered as lactoflavin. Chemically, this vitamin is composed of 3 benzene rings A, B, and C. In the slide, the name of A is pyrimidine ring, B azine ring, and C is benzene ring, while the chemical name of this vitamin is 6,7-dimethyl 9-B-ribotyl isoalexazine. Biologically, this vitamin is in active form once taken from the natural source, but after entering into the intestine, it is converted into active form with the help of certain enzyme. The active form of riboflavin or the coenzyme form of riboflavin are 2-FMN and FAD. FMN is flavin mononucleotide. In this, the phosphoric acid is attached to ribotyl alcohol group in position 5, while in FAD, flavin adenine dinucleotide linked to an adenine nucleotide through a pyrophosphate linkage to form FAD. This vitamin is widely distributed in the nature. It is present in plant and animal. Plant having the higher concentration, which is occurring in the east, while the good amount can also be taken from whole grain, dried beans, germinating seed. While in animal source, liver and kidney are the good source, while milk, egg, crab meat also containing highest content of this vitamin. Now come to metabolic absorption or metabolism as well as absorption. Riboflavin is the precursor for coenzyme flavin mononucleotide and flavin dinucleotide. Flavin nucleotide FMN and FAD are readily absorbed in small intestine. Free riboflavin undergoes phosphorylation, a prerequisite for the absorption into blood and plasma. Human blood plasma contains 2/3 as FAD and bulk of remainder as FMN. Riboflavin present in all tissues as nucleotide bound to a protein FP. The highest concentration is in liver and kidney. If we talk about excretion of this vitamin, mainly it is excreted in the free form and up to 50% as nucleotide in the urine, while in milk riboflavin is secreted in about 40 to 80% in the free form. In the feces, 500 to 750 microgram daily is eliminated as an unabsorbed bacterial synthetic form. Biosynthesis. FMN is synthesized from riboflavin via the ATP-dependent enzyme riboflavin kinase, which introduce phosphate group onto the terminal hydroxyl of riboflavin. FMN is then converted into FAD via the attachment of AMP, which is derived from ATP. The action of flavin adenine dinucleotide synthesis is occur with the help of another enzyme, that is flavin adenine dinucleotide synthetase. The enzymes that require FMN and FAD as a cofactor are termed as flavoprotein. Several flavoprotein also contains metalline and are termed as metalloflavoprotein. Both the class of coenzymes are involved in wide range of redox reaction and includes the same critical thymine-dependent enzyme, the pyruvate dehydrogenase complex, 2-oxaloglutarate dehydrogenase, branch chain alpha keto acid dehydrogenase, while the remaining enzymes which needs riboflavin as a coenzyme, including succinate dehydrogenase, glycerol 3-phosphate dehydrogenase xanthine oxidase, and during the reaction reduced form of FMN and FAD are synthesized as FMNH2 and FADH2 respectively. The daily recommended allowance of riboflavin for a normal adult is about 1.2 to 1.7 mg per day. Riboflavin deficiencies are rare and no definite disease, as like other vitamins, deficiency is also involved. Riboflavin deficiency is often seen in chronic alcoholism due to their poor dietetic habits. The symptoms are not definite, so the most common symptoms that can be associated with the deficiency including itching, burning eyes, angular stomatitis, cirrhosis, bloodshot eyes, glossitis, seborrheic dermatitis, and photophobia. Riboflavin decomposes when it is exposed to visible light, and this characteristic can lead to riboflavin deficiency in the newborn who are treated for hyperbilirubinemia by the phototherapy, so they must need a dietary supplementation. So the symptoms of deficiency of vitamin B2 related with the lips, tongue, skin, scalp, eye. Protein synthesis is impaired in severe riboflavin deficiency, since protein malnutrition interferes with utilization and retention of riboflavin. Hypervitaminosis of B vitamin are rarely occur because these are water soluble and they eliminated rapidly after producing their particular effect. But if there is any liver dysfunction or liver abnormality, so the hypervitaminosis can encounter in terms of photophobia, vomiting, itching, numbness, burning and pricking sensation, hypertension, fatigue, and production of bright yellow urine. Next vitamin is vitamin B3, which can also be known as niacin, PP factor, or plagra preventing factor. Niacin is also known as vitamin B3. It has two forms, nicotinic acid and nicotinamide. Both nicotinic acid, which is represented as Na, chemically pyridine 3-carboxylic acid, and nicotinamide, NAM, present in the tissues, can serve as the cofactor form of vitamin B3 in active form. All forms of vitamin B3 are converted within the body to NAD and NADP, that is nicotinamide adenine dinucleotide and nicotinamide adenine dinucleotide phosphate. NAD and NADH as well as NADP and NADPH refer to oxidized and reduced form of the cofactor respectively. In the next slide, I have given chemical structure of niacin and the nicotinamide. So you can see that the carboxylic group is attached in the niacin benzene ring, while there is a amide group attached in nicotinamide. In the tissue, nicotinamide is present largely as a dinucleotide, the pyrimidine and being linked to a D-ribose residue. Two such nucleotides active form are known as nicotinamide adenine dinucleotide. The other name are DPA, DPN and coenzyme 1. The compound contains 1 molecule of nicotinamide, 2 molecules of D-ribose, 2 molecules of phosphoric acid, and 1 molecule of adenine. A structure may be shown in the scheme. Nicotinamide adenine dinucleotide or NADP. Other name are TP and coenzyme 2. This compound differs from NAD in that it contains an additional molecule of phosphoric acid attached to second position of D-ribose attached to N9 of adenine. The reduced form of either coenzymes is designated by the prefix dihydronucleotide. Biosynthesis. Amino acid tryptophan is the main precursor of nicotinic acid in many plants and animal species, including human being. 60 mg of tryptophan can give rise 1 mg of niacin. So it can synthesize with the amino acid tryptophan, while it can be synthesized also by the intestinal bacteria. In the tissue, nicotinamide is not formed directly from nicotinic acid. It is formed by the degradation of NAD and NADP. So there are three biosynthetic forms or three ways by which niacin can synthesize. One from the tryptophan neurotransmitter, the second is the intestinal bacteria, and the third is the degradation of the actual coenzymes, that is NAD and NADP. Absorption and distribution. Nicotinic acid and its amide are absorbed from the small intestine. In the upper small intestine, it metabolizes into NAD or NADP to yield nicotinamide mononucleotide, which is then quickly hydrolyzed to form nicotinamide riboside and eventually free nicotinamide. Higher concentration of both forms appear to be absorbed by passive diffusion. Once absorbed from the lumen into the enterocyte, nicotinamide may be converted to NAD and released into the portal circulation. Most of the nicotinic acid and its amide in the blood is in RBC cells, presumably as a coenzyme. It is excreted in urine and it is excreted as nicotinic acid and nicotinamide. The normal adult on normal diet excrete both nicotinic acid and the amide form in the urine. In the next slide, formation of NAD and NADP is described in a schematic diagram that shows that the tryptophan, that is a neurotransmitter or a chemical which is found in the body, which is converted into niacin ribose phosphate, and this niacin ribonucleotide can also be taken in the form of diet, and with the help of enzyme and ATP dependent mechanism, it is converted into NAD and then NADP. The enzyme involved are NAD synthetase and NAD kinase. In the next slide, I have shown degradation of NAD or NADP. So NAD, when degraded with the help of NADase enzyme, it is converted into nicotinamide and D-ribose by the addition of a water molecule, while dietary nicotinic acid is converted into NAD and using the same pathway for the degradation. Similarly, intestinal bacteria, which are synthesizing nicotinic acid, and that NAD or nicotinic acid which is synthesized by the formation of tryptophan, all they are using the same pathway for the elimination. and the main metabolic form in which it is excreted in the urine is N-methyl nicotinamide. The dietary source of niacin. Niacin is not a true vitamin in the scientist's definition, since NAD can be derived from the amino acid tryptophan. However, the ability to utilize tryptophan for NAD synthesis is inefficient, given that approximately 60 mg of tryptophan are required to synthesize 1 mg of NAD. Also, synthesis of NAD from tryptophan requires vitamin B1 as a coenzyme to accelerate the reaction, as well as B2 and B6, which would be limiting themselves on a marginal diet. The recommended daily requirement of niacin is 13 to 19 niacin equivalent per day for a normal adult, while 1 niacin equivalent is equal to 1 mg of free niacin. If we check the animal source, almost all the organ meat, liver, kidney containing sufficient amount, as well as meat and fish can also give you a good source of niacin. Legumes, beans, lettuce, nuts, and green leafy vegetable, tea and coffee are also the good vegetable source of dietary niacin. There are enzymes, those requiring NAD and NADP as a cofactor, including those which require NAD, alcohol dehydrogenase, lactate dehydrogenase, malate dehydrogenase, glyceraldehyde 3-phosphate dehydrogenase, alpha-glycero P dehydrogenase, alpha-ketoglutarate dehydrogenase, while those enzymes which need NADP as a cofactor, including glucose 6-phosphate dehydrogenase and glutathione reductase, while some of the enzymes are those which need either NAD or NADP. These including glutamate dehydrogenase and isocitrate dehydrogenase. Biological function of NAD and NADP are following. NAD function as a cofactor for numerous dehydrogenases, pyruvate dehydrogenase, which is already discussed in the previous slide, and similarly the NADP H or NADP is also acting as a coenzyme or cofactor for the numerous reductive biosynthetic pathways which are involved in the fatty acid synthesis, cholesterol biosynthesis, steroidal hormone synthesis, and bile acid synthesis. And over 500 enzymatic reactions are those in the body which require vitamin B3 as a cofactor. There are certain factors which may be responsible for the deficiencies. The one and the important one is the poor intake due to alcoholism or any other reason. Several physiological conditions causing deficiency, for example, heart disease, malignant carcinoid tumor, and the use of certain drug therapies. For example, isoniazid, which is previously used for the control or for the treatment of tuberculosis. In Hartnum disorder, tryptophan absorption is impaired, and in malignant carcinoid syndrome, tryptophan metabolism is altered, resulting in excess serotonin synthesis. As far as its clinical significance or the deficiency sign are concerned, a diet deficient in niacin as well as tryptophan lead to cause glossitis of the tongue, that is inflammation of the tongue leading to the purplish discoloration, dermatitis, weight loss, diarrhea, depression, and dementia. These are the sign of minor or minute deficiency or a mild to moderate deficiency. In case of severe symptoms or severe deficiency, which is the leading cause of depression, dermatitis, and diarrhea, which is referred to as 3Ds. And these are associated with the condition known as pellagra. How we can define the pellagra? Pellagra is basically the characteristic of 3 different problems which are related with the skin lesions, GIT manifestation, and cerebral manifestation. The sign and symptom of deficiencies of vitamin B3 include pellagra. Pellagra include the trials of dermatitis, dementia, and diarrhea, and can lead to death. So if we define about the skin lesions, dermatitis involve the area of skin exposed to sunlight and subjected to heat, pressure, or irritation. These include face, neck, wrist, face, arm, elbow, breast, and perineum. While the GIT manifestation include anorexia, nausea, vomiting, abdominal pain with altering constipation, and diarrhea. Diarrhea become interactable later. Gingivitis and stomatitis is the reddening of lips and margin of the tongue. Achlorhydria is also present in about 40% of cases. That is the deficiency of hydrochloric acid in the GIT. These are the manifestation of GIT when the pellagra is arise or the deficiency of vitamin B3 is severe. While in cerebral manifestation, which are comprising of headache, insomnia, depression, and other mental symptoms ranging from mild psychoneurosis to severe psychosis. Journal effects which can be observed due to the B3 deficiency is inadequate growth, loss of weight, strength, anemia, and dehydration due to diarrhea. Therapeutic use and hypervitaminosis. Nicotinic acid but not nicotinamide when administered in pharmacological doses of 50 to 500 milligram, maximum 2 to 4 gram per day for adult. Usually the maximum dose is 2 to 4 gram per day and it is considered as the pharmacological or therapeutic dose. It lowers the plasma cholesterol level and has been shown to be a useful therapeutic for hypercholesterolemia. The major action of nicotinic acid in this capacity is the reduction in fatty acid mobilization from adipose tissue. Nicotinic acid also causes a depletion of glycogen store and fat reserve in skeletal and cardiac muscle. Additionally, there is an elevation in the blood glucose and uric acid production. For these reasons, nicotinic acid therapy is not recommended for diabetic or the person who suffer from gout. One of the side effects of nicotinic acid therapy that reduces patient compliance with its use is the cutaneous vasodilation, resulting in a burning flush in the face and upper body. This negative effect of nicotinic acid is the result of the activation of some receptors on the macrophage. Hypervitaminosis generally rarely occur, but if the person is taking large doses of water-soluble vitamin, usually other vitamin B cannot produce any harmful effect in case of hypervitaminosis. However, niacin excess can be problematic, usually when greater than 100 milligram niacin is taken per day. The large doses may cause flushing of the skin with dizziness, nausea, vomiting, diarrhea, hepatic toxicity in the rare cases, while abnormal heartbeat and abdominal pain. can also be seen and observed. Thank you so much. I hope this vitamin will be also interesting for you. Thank you so much.